We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
A preliminary investigation into a mysterious pneumonia outbreak in China has been identified as a previously unknown coronavirus.
Wuhan in China now on lockdown as the country struggles with fear of a pandemic.
Desperate measures to try and contain the deadly coronavirus.
More than 11 million people who live in that city now kept from leaving.
The COVID-19 pandemic is the greatest communicable disease outbreak to have hit Malaysia since the 1918 Spanish flu. Malaysia detected its first 3 COVID-19 cases on January 25, 2020.
Kita hari ini akan membuat laporan situasi terkini jangkitan 2019 nCoV dan pengesanan kes baru di Malaysia.
These were 3 Chinese nationals from Wuhan who entered the country from Singapore. The first wave of infections in Malaysia from January 25th to February 15th last year encompassed 22 cases. It was dealt with quickly through immediate isolation and treatment of the patients.
In March 2020, several countries in Southeast Asia recorded a significant increase in the number of COVID-19 cases as a result of the religious gathering known as the Sri Petaling Public Cluster. The event, attended by 16,000 people, eventually triggered a wave of COVID-19 infections across the country. The attendees who contracted the virus during the event brought it back home to their respective states, resulting in a spike of infections nationwide.
On the 16th of March, Prime Minister Mydin announced that the federal government would be imposing a nationwide lockdown known as the Movement Control Order, coming into effect on the 18th of March and lasts for 2 weeks. The move to act quickly and restrict people's movements with strict protocols were key in halting the spread of infections.
Dan untuk itu kerajaan memutuskan untuk melaksanakan perintah kawalan pergerakan mulai 18 Mac 2020 iaitu lusa hingga 31 Mac 2020 di seluruh negara.
On July 1st, Malaysia recorded 0 local transmissions for the first time since March.
There is now real hope that vaccines, in combination with other tried and tested public health measures, will help to end the pandemic.
On the 21st of February 2021, the first batch of the Pfizer-BioNTech vaccine arrived at the Kuala Lumpur International Airport. In February, Malaysia kicked off the national COVID-19 immunization program with former Prime Minister Tan Sri Muhyiddin Yassin and Health Director General Tan Sri Dr. Noor Hisham Abdullah, along with other medical frontliners, being the first to receive doses of the Pfizer-BioNTech vaccine.
The National COVID-19 Immunization Program, Program Imunisasi COVID-19 Kebangsaan, is a national vaccination campaign that is currently being implemented by the Malaysian government as an approach in curbing the spread of coronavirus disease and to end the COVID-19 pandemic in Malaysia by successfully achieving the herd immunity among its citizens and non-citizens that are residing in Malaysia.
Vaccinations are still going on at present with the vaccination of adolescents between the ages of 12 to 17 that started on the 8th of September 2021. As of recent, 90% of the Malaysian adult population has been fully vaccinated.
The aim of this video is to spread awareness on the importance of the vaccination and to get a little insight about the COVID-19 situation in Malaysia. Therefore, we've invited 2 members from the medical community to participate in our interview.
Next, introducing Dr. Helmy Haja Mydin, who is a consultant respiratory physician and head of lung center at Pantai Hospital Kuala Lumpur.
Introducing Dr. Rohini Kamalanathan, who is the Senior Director of Health and Wellness for Asia Pacific at Western Digital. She has also been managing the pandemic globally for Western Digital, which has around 65,000 employees.
What are your thoughts and views on the COVID-19 situation and the vaccine and immunization here in Malaysia?
Okay, so initially, I was very proud of the way Malaysia managed the first wave of infections. With the hard lockdown we had in March of 2020, Malaysia did well in minimizing the spread of the virus with manageable numbers of new daily infections. Of course, there were some stumbles along the way, not just for Malaysia, but virtually all countries in their attempts to contain the spread, right? And I think in Malaysia, after the Sabah elections, case numbers really exploded, which resulted in a sharp increase in daily case numbers and then also in particular death, especially in people who had pre-existing health conditions, as they are the most vulnerable to severe disease outcomes. At the peak, when Malaysia was reporting over 20,000 new cases per day, the focus on managing the outbreak shifted to one of vaccinations and herd immunity. It moved away from a containment and eradication approach. And I think Malaysia's done really well in the vaccination front. We are, I think, at one point, top 2 performing countries in the world with regards to their vaccine rollout for both adults and then now with the adolescent vaccine population. We're doing a really, really good job there. Achieving herd immunity through comprehensive vaccination will be our pathway out of the pandemic and into a phase where the virus becomes endemic, or what that means is embedded in the community, like influenza, for example. And then we manage this by having annual COVID shots and boosters.
If we want to look at things in a more sort of global perspective, we have to bear in mind that for the longest time, the amount of vaccines that were available was not sufficient for the number of people who wanted it. So lots of countries, even up to today, have not actually had a decent number of vaccines, and they haven't been able to implement a proper vaccination program for their citizens. So in that sense, I think we did quite well. And if you look at the numbers now, we're reaching almost 90% adult vaccination in terms of the number of people who've actually been vaccinated. That's something that I think we should be proud of and something we should celebrate. Now, of course, learning in terms of how best to proceed with the different types of vaccines, which vaccines are appropriate, how best to engage people who are deemed to be anti-vaxxers, how to go to more rural areas. So a lot of things, I suppose, were things that we had to learn along the way as well.
But of course, we always need to be on the lookout for new variants of the virus, which may require a specific strategy to combat. So the faster we get the majority vaccinated, then the less chances we have or we give the virus to mutate.
What do epidemiologists mean when they talk about herd immunity?
So herd immunity, which is also known as population immunity or herd protection, is the indirect protection from an infectious disease through vaccination, or immunity is developed through previous infection.
Herd immunity is basically, it's like when you're trying to protect a fair number of the population, right? What you're doing is you're indirectly protecting a lot of people from an infectious disease, because when you are able to vaccinate a certain percentage of the population, let's say 70-80% of the population, then what happens is there's actually going to be a drop in the number or the amount of the virus that's circulating in the community. And by virtue of allowing that numbers to drop, you're then also decreasing the propensity or the ability of the virus to spread. And then eventually the numbers start to go down, and you may not even need to vaccinate everyone in order for the number of viruses or the number of diseases to be under control.
Given the trend these past 2 months, we are aware that the number of cases has started to decrease. Would you agree that this is attributed to the vaccine?
I would say that it is partly due to the vaccine. I wouldn't say all of it is due to the vaccine alone, but it's definitely a key factor, because once again, you're cutting down the number of cases. But bear in mind that vaccines, even those who are vaccinated, may still get the disease. It's just that the risk and the probability of getting it and also of passing it on to others is much, much lower. The key thing about the vaccine, though, is it stops or it really drastically reduces the number of complications and the number of deaths from those who do actually get the virus. So yes, the vaccine, I think, is a key component as to why the numbers are dropping. But just as importantly are all the other public health measures that we are seeing and that we are doing, things like as simple as wearing a mask, keeping our distance in terms of people around us, making sure that we don't go to poorly ventilated indoor areas. These are measures that are just as important in keeping the numbers down.
Oh, absolutely. Yeah. As I mentioned before, our vaccination strategy is the only way to move on from the pandemic phase and into an endemic phase, where an adjusted approach to management of the virus allows us to return to the new normal. No one is safe until everyone is safe.
With the vaccine being relatively new, how safe is it?
COVID-19 vaccines are absolutely safe and effective.
Now, there are different types of vaccines. We're using different types of technology. Ultimately, all these vaccines have the same goal, which is to stimulate the immune system in such a way that you create antibodies that are ready to fight off the virus when the virus eventually, or if at some point, invades the body. So the end goal is the same. Now, the mechanism of getting there, then there are various ways of doing so. And the one that's deemed to be relatively new is using a technology called the mRNA to create these, I suppose, these entities within your body to defend yourself. But the technology is not actually new. It's been there for at least a couple of decades. It's just that it's being utilized for the first time in the context of creating a vaccine for a virus. Now, bear in mind, the virus itself is relatively new. It was only discovered at the end of 2019. So, of course, the treatment is going to be new. But with vaccines, we're talking about prevention. We're not talking about treatment. And even that's going to be new.
It was evaluated in tens of thousands of participants in what we call clinical trials. The vaccines met rigorous scientific standards for safety, for effectiveness, and manufacturing quality needed to support approval or authorization of a vaccine in all countries, right? And then it underwent the same rigorous process by local health and FDA authorities in each country. In my opinion, safety was not compromised by the speed of the vaccine development and emergency use authorization.
The whole purpose of the vaccine is to reduce the number of critical or complicated diseases as well as deaths.
So the reasons that vaccines may be approved so quickly was because large clinical trials to assess vaccine efficacy and safety were happening at the same time as the development of the vaccines. So typically, large-scale manufacturing begins only once the vaccine has been tested in clinical trials. In the case of COVID-19, governments wanted to be ready to begin distributing the vaccines the moment the results of the phase 3 clinical trial were known and the safety data had been analyzed. And so the upside was that if the vaccine is safe and effective, it can be distributed immediately and vaccination can begin, which is why we could begin vaccinating people globally in less than a year during this pandemic.
Booster shots are such a hot topic at the moment globally. Are booster doses recommended for everyone, and how soon after being fully vaccinated?
Now, introducing booster doses should be firmly evidence-based and targeted to the population groups in greatest need. So administration of booster doses will just increase vaccine inequity.
The concept behind it is you get vaccinated, you get immunized, but as time goes by, it is likely that the degree of protection that you have is going to start to wane off. And at some point, you may need a booster shot to increase the antibodies again that's in your body to fight off the virus or to give protection, to protect yourself from the effects of the virus. Now, it's still a developing issue in terms of which vaccine needs to be given when, but generally it would appear that 6 months and later is the right time for a booster shot. And whether or not you get, say, type A, B, or C, once again, depends on what you had initially. So lots of studies are ongoing.
WHO continues to monitor this, but right now the recommendations are that booster shots are only given to the high-risk population, so in senior citizens with pre-existing medical conditions, and to the population that is at high risk, like frontline healthcare workers, or anyone that is above 18 years of age, but suffering from a pre-existing medical condition or comorbidities.
These are individuals who are at higher risk of developing complications and therefore should be deemed as priorities for booster shots.
Everyone else that is fit and healthy, at this point of time, we can afford to wait. There is no need to get a booster shot for now. if you're fit and healthy and young, right?
In your opinion, what can be done to attract anti-vaxxers to get vaccinated?
Something that I have been dealing with for the last 1 year.
I think a lot of it boils down to engagement. Look at the anti-vaccine movement as a whole, right? They're not homogenous. Everyone's slightly different. There will be those hardcore fanatics who would never take anything ever. And these tend to be the loudest. So you tend to see them on newspapers or media outlets. You tend to hear their voices or their views, or you tend to hear them go on a rampage on Twitter or anywhere or any of these social media platforms. But they don't necessarily represent the majority of people who most likely have some concerns that are quite legit.
What we need to understand is that many people continue to have concerns and doubts about the COVID-19 vaccines, despite the overwhelming evidence that they are safe and effective.
So, some people may want to know, are these vaccines safe? Like you said, these vaccines are new. Is it really safe? Should I give it to my kid? Are these vaccines going to cause side effects? Are these vaccines going to cause any permanent damage to me? Is this something that I really want to give my family, my loved ones? So these are all legit considerations and valid questions that shouldn't be brushed aside. So I think for a lot of people who are, I wouldn't say anti-vaxxers, but perhaps are more vaccine hesitant, they're a bit more hesitant about getting the vaccine. That's where engagement and education comes into play. And we need to do exactly what you're doing, interviewing people, talking to people, getting more information, sharing it out, spreading it out there. And I think that makes a lot of difference. But there will always be that tiny minority of hardcore fanatics whose mind will not be changed. But I don't think that we should focus on them. We should focus on those who actually want information and are hungry for the right type of information.
I think it's important to talk with vaccine hesitant friends and family about the need for everyone to get vaccinated so we can all end the pandemic. However, the way you speak with a vaccine hesitant person makes a big difference in helping them make the decision to get vaccinated or not. I would advise against shaming or arguing, as it does not work. It's important not to attack people with facts or use the word fear, right? Rather say, use the words concerns or doubts. Generally, if you mention fear, they may become defensive, especially if they struggle to show vulnerability. So while some people will openly talk about their fears, some others may not, and they would deny that they are afraid. Once you ask the question, listen to their concerns, give them the facts, and then let them decide. It's important to ask questions and really listen. To be able to put your own perspective on hold, you must acknowledge that it is their right to choose whether they want to get vaccinated or not. You may not agree with it or like it, but the choice is not yours to make, right? I also recommend trying to understand the nature and the source of the person's fear, whether that is getting sick from the vaccine or being controlled or manipulated or because of conspiracy theories or social pressure or a lack of information. You need to ask those questions. So some examples of questions that you can use to start a conversation could be, you could say, what would make you feel more confident? Or what would make you more comfortable to get the vaccine? Or you could say something like, what information would you need to think of the vaccine differently? Approach the question that way. What has the potential to change your mind, for example, right? So, but ultimately what we need to remember is that it is a choice. And maybe as legislations get implemented or SOPs that require vaccination to do certain things like, travel or visit public spaces like bars and restaurants and cinemas, get implemented, I think that will obviously pause the issue, because if they continue to choose not to get vaccinated, they will have to be prepared to give up some of their liberties in order to protect themselves and the people around them. It will become a difficult choice, in my opinion, but who knows? No, I think this is, thank you for having me. I'm really honestly thrilled to be here. And I hope that, I provided a little bit more insight into the pandemic and, what we've been going through for the last 18 months.
Okay, thank you so much.
I wish you guys all the best.
Why do you not want to get vaccinated?
Oh, well, I contracted COVID-19 in the month of May this year. All right, and I was able to. That means I have got natural immunity with me because I contracted it. So that's why I don't see a necessity to be vaccinated. And number two, vaccination. There, I do some research. There is lots and lots of questions need to be answered by these so-called experimental and emergency use of vaccine. I think the very word they used, experimental and emergency, tells a lot about the vaccination. It means the vaccine is not proven. The vaccine has got a lot of answers that they require to answer. So that's the reason why I am not taking it, as yet.
With so much information out there, why are you still hesitant to get vaccinated?
Well, a lot of information is only, I don't think there are a lot of information. There are a lot of questions that the vaccines of producers are not answering them. And the questions of concern are more than what they can tell us about the good of vaccine. Number one, vaccines don't guarantee you that you will not be infected. Vaccine doesn't guarantee you that you will not transmit. All right. So to me, it is a very silly thing to have a vaccine and you have nothing to boast about, except that nobody can prove it. That it will give you it will help you to overcome. If you contracted it, you are in a better position, stronger position to overcome COVID. And I think that statement anyone also can say, because I have contracted COVID and I did not even have vaccine, a single dose, and I recovered from it. So it is just a big BS lah. If you say vaccine is really so many information about good things about vaccine, I think there are more adverse results that the vaccines refuse to answer. Or they have been trying to hush this, and this makes me all the more doubt the credibility of those people promoting vaccines.
Do you think the vaccine contributes to the recent drop in daily cases?
Okay, let me take it this way, all right? They would like everyone to see it in that way, that, more and more people are getting vaccinated, so therefore the numbers have dropped. I think that is also another big BS. Number one, we have not been doing a lot of what we call swab tests on a lot of what we call red area, or we call highly, unlike Singapore, they start up with the kilang, with the hostels and all that, and that's why the numbers were real huge against us, and we were resting on L'Oreal. Oh, we are so few, we are well taken care. We are doing very good SOPs. These are all plain nonsense. All right. So I think it is not because of vaccination too. Because why? If you say vaccination does help, then my question is, why people who are vaccinated with double doses are still contracting COVID?
What makes this COVID-19 vaccine different from the previous vaccines you have taken?
Oh, the other vaccine, once you take it, you are good forever, right? Like all those mumps or Bella jab, or I don't know, those vaccines that we have, a chicken pox. You cannot call yourself a vaccine if after you taken the vaccine and then you are susceptible to get the disease again. And that is not a vaccine, all right? We understand vaccine from day one. When we go to school, we took all those vaccine. We never get this problem, cholera, all this thing. This is eliminated completely, all right? Because we are then you can call this vaccine as immune, immunology. This vaccine now we are talking is experimental. At least they are honest here. The only thing they are honest in this new vaccine is that they call it an experimental and emergency use vaccine. The word itself tells you something is not right about this vaccine. This vaccine is not proven. This vaccine has got a lot of question marks. That's why we call it experimental and we call it emergency use. All the way we know our old vaccine, once you take it, you are completely healed. You have no worries of contacting the same disease again. All right, but not for this COVID vaccine. All right, not for this COVID vaccine.
That concludes our interview.
The pandemic has taken a major toll on the mental health of Malaysian citizens all over the country. Introducing Mr. Gary Yap, who is a clinical psychologist at My Psychology. He also has a master's in clinical psychology. How do you think the lockdown has affected people?
I guess one of the big impact of lockdown is it brings a big changes in our daily routine. The changes that come with a lot of uncertainty that makes us losing our control. For example, previously we can go to the shopping mall, we can meet someone, we can find our friends for eating out, etc. So all these are supposed to be within our control, are outside of our control. Mm-hmm. So all are restricted, and with that, when we are all locked down, which means that we have restrictions of these activities, but we have to stay in the house, right? We have to work from home, while children need to study from home. That's when the tensions can also come in as well within the house. So the stress can come from external, like we're not having access to the places, but also comes from internal as well, because the changes come from relationship. Maybe before the pandemic, before the lockdown, you see your parents or you see your partner maybe just at night, at dinner. Mm-hmm. But when you spend the whole day with them, this can be a lot of changes. Maybe so much thing that we didn't expect, but it happened. So tensions come from relationship as well, come from the stress, and also come from the anxiety, because we don't know what to expect in the future. All this will hit us at different level, at different aspect.
How has learning online for such a long period of time with little to no social interaction affected children and teenagers?
I guess one of the big impact is the loss of physical connections, or we call it the social, the social learning, social activity. I would say it's the isolation, physical isolations with our friends, and especially when it comes to children and adolescents. That's when peers are very important. So we are losing the face-to-face touch. Another one, I would say we are losing sensory experience when it comes to learning.
How would the pandemic affect people psychologically in the long run?
I would say it comes with multiple directions. Pandemic, firstly, it affects job, it affects financial. That's where the stress can arise. When we suffer financially, when we suffer from relationship, we probably feel more stress, and we need to keep adjusting. When we are adjusting, it depends on how many stresses are you handling, and do you have enough support. If you have more stressor coming in, your family, your job, your children, all this, while in the meantime, you are lacking of support, we may have high risk of having high stress, burnout, depression, or anxiety. So our clients, before the pandemic, they already suffering at minimal level of depression, anxiety, or even sleep difficulties. But because of the COVID, when they are hit by many directions, lacking of support, because previously probably your friends or family, they are your support system, but they are also struggling with the same thing. Mm-hmm. So when we are all connected with this stress, with all the uncertainty and losing control, we may have high risk. So I do see a lot of clients, having like burnout, high stress, depression, anxiety, or even insomnia, like sleep difficulties. These are quite common.
What would you do to change people's views about counseling, getting help, etc.?
I would say since the pandemic, we see an increase of receptiveness. Like people are calling helpline, people are reaching out for counseling, people are applying for online therapy. But how do I encourage? I would say I would normalize it first. So if we can recognize depression, anxiety, or high stress or burnout as a mental health condition, just like fever, it is about really normalizing it, telling people that, it's just like fever. If you know what to do with fever, this is also, we can do it the same way, or we can give the same respect or care to someone who are suffering from mental health struggle.
How can people improve their mental health during such difficult and trying times?
I would say it goes back to self-care, because this pandemic is a big experiment for every one of us. Are we able to be flexible? Are we able to adapt to changes and uncertainty? So how can we face this? I would say you can use these 2 questions to guide yourself. When there are so many things that are out of our control, you don't have to focus at everything. You can ask yourself, what is important now? It can be your work, can be your health, can be your relationship. So ask yourself, what is important now, and what is within my control? So it's really about, making choices within our control. If we make choices within our control, or we focus on something that is important to us, does it get rid of the stress completely? The answer is no, but it can at least reduce the struggle. in the
Yeah.
pandemic.
Thank you so much for taking the time to.
No problem.
These are some hotlines with regard to the topics discussed in this video.